Have you ever noticed an elderly loved one suddenly acting confused, having trouble speaking, or losing strength in an arm, only to seem fine again within an hour? If so, they might have experienced something called a mini-stroke or what doctors call a TIA, transient ischemic attack. While it's easy to dismiss these episodes because they seem to get better on their own, mini-strokes are urgent warnings that a major stroke may be coming. Today we're going to talk about what a mini-stroke really is, the most common symptoms of a mini-stroke in the elderly, how to tell the difference between a TIA and other conditions, what to do immediately if you suspect a mini-stroke, how to reduce the risk of a full-blown stroke in the future. Whether you're a caregiver, a concerned family member, or simply someone who wants to be prepared, this video will give you clear, compassionate, and practical information you can use right away. Let's get started. What is a mini-stroke? Understanding TIA. A mini-stroke, also called a TIA or transient ischemic attack, happens when blood flow to part of the brain gets blocked temporarily. Unlike a full stroke, the blockage clears up on its own, usually within minutes to an hour. Because the brain tissue doesn't die, people often recover quickly and may look completely normal soon after. But don't be fooled, a mini-stroke is a serious warning sign. According to the American Stroke Association, small blue diamond, about 1 in 3 people who have a TIA will have a full stroke later. Small blue diamond, nearly half of all strokes happen within the first few days after a TIA. That's why every TIA needs immediate medical attention even if symptoms go away. Why are the elderly more at risk? Older adults face higher stroke risks because of aging blood vessels, which stiffen and narrow over time. High blood pressure, the #1 risk factor for stroke. Atrial fibrillation, an irregular heartbeat that can form blood clots. Diabetes, which damages blood vessels. High cholesterol, which leads to plaque buildup. Previous strokes or TIAs, history raises the chance of recurrence. These factors make it essential to know the symptoms and act fast. Symptoms of a mini-stroke in the elderly. Because a mini-stroke can look like other problems, it helps to know the classic signs. Think fast. A simple way to remember the most common symptoms. A face drooping. Ask them to smile. Does one side of the face sag or feel numb? A arm weakness. Ask them to lift both arms. Does one drift downward? Speech difficulty. Ask them to repeat a simple sentence. Is speech slurred or hard to understand? Time to call emergency services immediately. But a mini-stroke can cause other symptoms too, especially in seniors. Small blue diamond, sudden confusion or trouble understanding speech. Small blue diamond, sudden vision changes in one or both eyes. Small blue diamond, sudden trouble walking, dizziness or loss of balance. Small blue diamond, sudden severe headache with no known cause. Small blue diamond, sudden numbness or tingling, often on one side of the body. Small blue diamond, loss of coordination or sudden clumsiness. These symptoms usually last a few minutes to an hour. But even if they stop, you must get medical help right away. How long does a mini-stroke last? A TIA is defined by how quickly symptoms go away. Most TIAs last less than 60 minutes. Some last only a few minutes. All symptoms should fully resolve within 24 hours. If symptoms persist beyond 24 hours, it is considered a full stroke, not a TIA. How to tell if it's a mini-stroke or something else? Sometimes other conditions can mimic a TIA. Small blue diamond, low blood sugar, sudden confusion or weakness. Small blue diamond, seizures, brief loss of awareness or muscle control. Small blue diamond, migraine with aura, visual changes and numbness. Small blue diamond, inner ear problems, vertigo or balance issues. But here's the rule, never try to diagnose it yourself. If there is any doubt, call emergency services right away. What to do if you suspect a mini-stroke? This is critical. 1. Call 911 or your local emergency number immediately. 2. Note the time symptoms began. Treatment options depend on how long it's been. 3. Stay calm and reassure your loved one. 4. Do not give food, drink, or medication unless instructed. 5. Be ready to describe all symptoms clearly to emergency responders. Remember, time lost is brain lost. What happens in the emergency room? When you arrive, the team will perform a neurological exam to assess movement, speech, and reflexes. Do imaging tests such as a CT scan or MRI to look for blockages or bleeding. Run blood tests to check for clotting problems, infections, or low blood sugar. Sometimes perform an ultrasound of neck arteries to look for plaque. Check heart rhythm for atrial fibrillation. These tests help determine whether it was a TIA or full stroke. What caused it? What treatment or prevention steps are needed? Why you can't ignore a mini-stroke. Even though symptoms disappear, the risk of a major stroke is highest within the first 48 hours. Research shows small blue diamond, about 10 to 15% of people have a full stroke within 3 months of a TIA. That's why early intervention is critical. Blood thinners may be started to prevent clots. Cholesterol medications can stabilize plaque. Blood pressure medications may be adjusted. Surgery or stenting may be recommended for severe artery narrowing. How to reduce stroke risk after a mini-stroke. If your loved one has had a TIA, you can take steps to lower their risk. 1. Control blood pressure. Target below 130/80. 2. Manage diabetes. Keep blood sugar in a healthy range. 3. Lower cholesterol. Heart-healthy eating, exercise, and medication if needed. 4. Take prescribed medications. Don't skip doses of blood thinners, blood pressure meds, statins. 5. Eat a balanced diet. Focus on whole grains, vegetables, fruits, lean proteins, healthy fats. 6. Be physically active. Even short walks help circulation. 7. Avoid smoking. Tobacco damages blood vessels. 8. Limit alcohol. Too much increases blood pressure and stroke risk. 9. Treat sleep apnea. Breathing problems during sleep strain the heart. 10. Monitor symptoms. Call the doctor if you see any new warning signs. When to call for help again. Call emergency services if your loved one has sudden weakness or numbness, trouble speaking or understanding speech, vision loss, dizziness or imbalance, severe headache. Never wait to see if it will go away. Emotional impact of a mini-stroke. After a TIA, it's normal to feel fear of another stroke, anxiety, depression, loss of confidence. Offer reassurance. Recovery is possible. Many people prevent future strokes with treatment. Counseling and support groups can help. How caregivers can help. If you're caring for someone who has had a mini-stroke, be patient with memory lapses or confusion. Encourage healthy habits gently. Organize medications with reminders. Create a safe home, remove tripping hazards, improve lighting. Go to follow-up appointments. Your support makes a huge difference. A message of hope. A mini-stroke is scary, but it's also an opportunity. With quick action and lifestyle changes, many seniors never go on to have a full stroke. Knowledge is power. You can recognize the signs. Get help fast. Take steps to protect your loved one's health. If you found this video helpful, please subscribe to our channel for more guides on stroke prevention, senior health, and caregiving. And if you know someone who cares for an elderly loved one, share this video with them. Every minute matters and knowledge can save lives. Thank you for watching. Stay prepared, stay compassionate, and remember, you are not alone.